Canada makes higher medical cost threshold for immigration candidates permanently. The Federal Immigration Department of Canada has made a temporary policy permanent on medical inadmissibility, which is affecting those with chronic conditions, physical disabilities, or a continued need for social services. The temporary public policy for excessive demand on health and social services, which came into effect on June 1, 2018, was made permanent in Ottawa on March 17. The Immigration, Refugees and Citizenship Canada spokesperson, Béatrice Fénelon, stated that the policy escalated the current cost threshold to 3 times the average Canadian per capita cost of health and social services, and altered the definition of social services to take away the reference to special education, personal support services, and social and vocational rehabilitation services. Medical cost threshold increases by 10.4% to $24,057. The threshold for the annual cost this year for a foreign national seeking permanent residence in Canada is $120,285 over 5 years, or $24,057 per year. That is the amount of money estimated that would exceed the Canadian average because of an applicant's social services and health. The annual cost threshold was $21,798 this year for each foreign national who was seeking Canadian permanent residency, and $120,285 for more than 5 years. Last year the threshold was 3 times the average cost of $7,266, which was $21,798 for those services for a Canadian. This year reflects the rise of almost 10.4%, 3 times the $8,019 on average for a Canadian to receive healthcare and social services each year. Canada uses the annual cost threshold to decide if a prospective would burden the Canadian taxpayers. With higher cost thresholds, Canada is more inclined to include individuals with disabilities and bear any costs resulting from obligatory treatment for their medical or psychological health conditions. Fénelon stated that the value of the excessive demand cost threshold is updated by the provincial, federal, and territorial governments every year based on health spending per capita, as reported in the annual health expenditure report by the Canadian Institute for Health Information. Published on March 16, 2022, Ottawa made the temporary policy permanent with its amendments to the Immigration and Refugee Protection Regulations excessive demand by formalizing it. Fénelon further added that these changes create a balance between protecting publicly funded social and health services while welcoming newcomers through a fair and compassionate immigration system into Canadian society. Canada allowed 85% of applicants when it increased its cost threshold. These applicants under the old definition of excessive demand would have been previously refused under the new policy demand to be approved. The cost considered for the needs of an applicant for healthcare and social services are as follows: dialysis, home care by a respiratory therapist, physiotherapist, nurse, or another care provider, psychological counseling, day facilities offering constant supervision such as respite care, residential facilities, including substance abuse services and long-term care, palliative care, nursing services, medical aids, appliances and prostheses, pharmaceuticals and pharmaceutical services, laboratory and diagnostic services, chemotherapy and radiotherapy, hospital services, physician services, supplies related to these services, and psychiatric services. The cost threshold for unrestricted demands is not given much attention in public discussions on immigration. An applicant's education, work experience, and financial means is a significant consideration that could prevent an application getting approved. While he was admitted, the people responsible for his protection, and who were supposed to care for him and treat him facilitated the Canadian Border Service Agency's arrival. There are sometimes exceptions that are made under Canada's medical inadmissibility policy on compassionate and humanitarian grounds. You have reached the end of today's video. If you found this video helpful, please like, share and subscribe to our channel. Thanks for watching.